I won't stand by and allow this virus to threaten to cause more pain and more heartache in our country. So that's why last night the Health Secretary announced new restrictions on household contact in the North West, specifically Greater Manchester and in parts of East Lancashire and West Yorkshire. These are targeted measures on social contact between households, which the data tells us is driving the current increase in cases. Businesses and workplaces should continue as before in those areas. I know how hard it is to have restrictions like this imposed on seeing your family and your friends, but we have to act rapidly in order to protect those we love. On Saturday, the 1st of August, you'll remember we had hoped to reopen in England a number of the higher risk settings that had remained closed. And today, I'm afraid we're postponing those changes for at least a fortnight. That means until the 15th of August at the earliest, casinos, bowling alleys, skating rinks and the remaining close contact services must remain closed. Indoor performances will not resume. Pilots of larger crowds in sports venues and conference centres will not take place, and wedding receptions of up to 30 people will not be permitted. But ceremonies, of course, can continue to take place in line with COVID secure guidelines. And I know that the steps that we're taking will be a real blow to many people, to everyone, obviously, whose wedding plans have been disrupted or who cannot now celebrate Eid in the way that they would wish. And I'm really, really sorry about that, but we simply cannot take the risk. We will, of course, study the data carefully and move forward with our intention to open up as soon as we possibly can. I don't want to tell people to spend less time with their friends, but unless people follow the rules and behave safely, we may need to go further. 2 weeks ago, I said we would hope for the best, but plan for the worst. And of course, we continue to hope for the best. But the way to get that and to achieve that optimum outcome is if we all follow the rules, wash our hands, cover our faces, keep our distance, and get a test if we have symptoms so that NHS Test and Trace can keep the virus under control. And that is how we will avoid any return to a full national lockdown.
I think what we're seeing from the data from ONS and other data is that we have probably reached near the limits or the limits of what we can do in terms of opening up society. So what that means, potentially, is if we wish to do more things in the future, we may have to do less of some other things. And these will be difficult trade-offs, some of which will be decisions of government and some of which are for all of us as citizens to do. But we have to be realistic about this. The idea that we can open up everything and keep the virus under control is clearly wrong. And what we're seeing is that we are at the outer edge of what we can do, and therefore choices will need to be made. But people, I think, are very clear, for example, that schools are an absolute priority for the welfare of children.
Listen, thank you all very much indeed. And hands, face, space, get a test, self-isolate if you have symptoms. Thanks very much. I think I repeated that often enough.